Hi, this is the Art of Hair Transplant Restoration Surgery result with a 7-month follow-up, and this is her natural hair. No topic, no concealer, nothing. This is, she wear natural, and you see how excellent density that it comes in with my work. If you compare my work with a lot of clinic, especially with African curly hair, mine is extremely dense, and you know, and not only dense but how natural the hairline is. But I'm going to show the audience what she looked like 7 months ago. She had early growth because she mentioned to me that even she didn't notice any hair loss, hair shedding after transplant. And a month later she started to notice hair start growing out real quick. Again, it's very rare to have it. Majority of the time it takes a year for it to fully grow. So I'm extremely happy for her that it just takes a few months, and this is 7 months, and with this is excellent density. But let's start from the beginning. Okay, so that was her, and basically we lowered the 1 inch in the front, and then we fill in both temple edge, and she's balding. And this is a very classic case for genetic pattern, for specifically very common among African American women. Again, with hair transplant, if you want to have excellent result, you gotta find out that if the surgeon specialized in black curly hair, especially if you have black African curly hair, you gotta find a surgeon who work with a lot of curly hair. If the clinic or the surgeon say they do, you want to be able to see a lot of before and after. You can't trust what people write only, because those are very subjective. You want to be able to see objectively, and how do you know? You want to see a lot of before and after. And this client, she did quite a bit of thorough research and for many years before she decided to settle on my work. And see how natural, and again, it's not a circle, it's a lot of detail, zigzag. And again, hair transplant, you need both an artist and a surgeon. The surgical skill of the surgeon will give you the density, but the artistry and the artist that's how we give you the most natural hairline. And you want to be able to walk down the street, no one know you have had surgery. And that was her before. You see how advanced hairline she had, and look at that. And you see it has nice curve, nice zigzag, and this real natural look. And that's that. And look at the density, and look at the top view and the top view. And that was her. And you see, and again, this is real hair, no topic, no concealer, none of that stuff. Can you turn toward me and straight, and turn to the other side? Look at that density, and look straight at me, and look down. And that was 7 months ago, and go straight at me. And you know, she's kind enough to allow me to show the audience the result, because you know, it's very helpful for her doing with other women. And again, she not just help me, but she want to help other women who has similar hair loss, because it's important. You want to be able to see a lot of before and after, and it's very difficult to find those results, the before and after. Nowadays, people do hair transplant, but the old day, they do what called a scalp excision. So they cut out the whole skin, and then they lower your scalp down and they suture you up. Now those are very archaic. They leave you a linear scar and a big huge scar in the front. You won't be able to pull your hair back. Number two, you won't be able to have a natural hairline, because cutting will not give you the artistry of the hairline. And number three, you're gonna be a very not just scarring and abnormal hairline, but you're gonna be in great pain, and you're gonna need multiple surgery, because you're gonna need hair transplant in front of the scar to hide it. And on top of it, it can cause shock loss, and you can lose more hair behind it too. So you rather do hair transplant from the beginning, and this is the most advanced technology available. And so this is the artistry of hair transplant on a woman with 7 months follow-up. Thank you.